We're here at St. Joseph Hospital with Dr. Brandon Lewis. He is the Medical Director of Emergency Services here at St. Joseph Hospital. And first of all, thank you for joining us. Our big key is facts, not fear. I guess let's start off with the basic. What exactly is Ebola? What do people need to know about this virus?
Well, Ebola is a virus that's endemic really to Africa and pops up actually every few years. Ebola, they have outbreaks like this. This one is a little bit larger, but it's just like any other virus that you can get, whether it's a cold virus, flu virus. It does happen to be more serious if you get it than the flu. But you know, throughout history, flu's killed millions, hundreds of millions of people. And this is another virus like that that's really coming up.
How exactly does this spread? For people who are wondering, how can you get Ebola? How does this happen?
Yeah, so the Ebola virus is spread really through bodily fluids. So blood, feces, urine, sweat, saliva. It really is a direct contact type of virus. So I don't think that we've seen any cases, especially here in the United States, that didn't occur without some direct contact with a patient with Ebola and their bodily fluids.
When you hear about people riding a plane and things like that, what would be an instance where they could get the disease? If someone is there, how would that happen? I mean, we've heard sneezing, coughing. Is it just something that can go from hands? Just kind of explain that a little bit more.
Sure. So first of all, really a patient is not going to transmit the virus until really they're symptomatic. So it's not going to be you and I sitting here and I reach over and touch you. I don't need to worry about that. Someone who's got the symptoms though, fever, nausea, vomiting, body aches, headaches, those things, then if I'm exposed to their bodily fluid, so they're going to cough in my hand and then reach over and touch me, or I'm going to be touching a bodily fluid somewhere in a restroom that that they left there. Those are the kinds of places, and even those kinds of situations where you're talking from a person to an inanimate object and then to another person. Viruses don't exist forever on those surfaces, so it's not like if anyone's been through this airport or bathroom in the last month that I could pick something up.
Okay, since you kind of mentioned that, go off of what do people need to do? Because obviously we all know when it's flu season, you wash your hands, you do things like that. Should it be as simple as things like that? Continuing to do those types of things to avoid any chance, I guess.
It really is. I mean, it's just like we tell people every flu season, when you're coughing, cover your mouth. When you're around other sick people, try to avoid that contact with them. Wash your hands. Do those things to protect yourself. You do see people from time to time, even here at the hospital, just wearing a surgical mask. If they're around people that are coughing and they want to take extra precautions, those are things that they can do. But really the number one thing is just stay away from where it is. And the nice thing is that, so far the reports are there's 3 people in the United States that have come in contact, and the screening tools that the CDC uses are very clear about the types of contacts that could be at risk. Can you always find someone somewhere with the possibility that they may have something that you don't know about? Sure, that's true of all sorts of diseases.
Right. We've heard of there's even things like measles and mumps. It's not something that is too prevalent all the time. And that's much more contagious than something like Ebola. Can you just kind of explain some things that you mentioned, the flu even? That's something that people deal with every single season, and more people actually die from that. Can you just talk about where this is kind of on a chart of viruses, I guess, a little bit?
Sure. I mean, there are plenty of other viruses out there. There's actually some making the news. This new enterovirus D68, for example, is causing a lot of problems. It's causing paralysis in kids, but you don't hear people talking about, that particular one. I think Ebola gets a lot of press because it does have a high mortality. If you get it, there is a really large chance that you could die from it. So obviously, when something's that serious, we do want to take extra precautions and we want to be very aware of it. But at the same time, infection control is not limited to the really dangerous ones. There are also, infections out there like pertussis, for example, is one that we have a vaccine for that's killed many people throughout history. People are starting to, sort of wane off of the vaccines. There's some distrust that's developed with vaccines, and so now people aren't taking them. We're seeing recurrent pertussis again. and that's something that affects kids and can kill them too.
Can you talk about what's happened with hospitals in general? Because obviously people are a little bit concerned about what they see, what they hear, and things like that. What are hospitals doing, and the CDC? What are together, I guess, to make sure this doesn't become a problem, which they're confident it seems like it's not going to be that big a problem?
Sure. Well, you never can predict how an outbreak is going to happen. Like I've mentioned, in Africa, they have these, multiple times over the past decade or so, really almost 20 years. And so finding the right processes and procedures, becoming refined in how we do those things. There are some media events about hospitals where maybe protocols weren't followed. But hospitals and health systems going through the process of training and retraining, learning from our mistakes, those are all things, more importantly, learning from other people's mistakes, and going through those processes to really refine that so that when that situation does occur, we're ready for it.
Talk about the treatments that these people are going through, because obviously you said it is a very tough virus to fight and that sort of thing. What are they doing to try and take care of these people? Can you just explain how that works a little bit to try and fight this for people here?
Sure. There are not a lot of great medicines out there to really fight viruses. Most people think of antibiotics. They come in, they want to get some penicillin or something. Those are really for bacterial illnesses. Viruses come on, they run their course, and then they leave in most cases. The treatment for most viral illnesses, including Ebola virus, is really supportive. If it's having effects on your body, you're becoming dehydrated, or your electrolytes, the salts in your body, become abnormal, we need to fix those. If it's causing problems with your breathing, then we need to support your breathing. If it causes your kidneys to have problems, we need to support your kidneys. So we basically support patients through those kinds of illnesses and wait for the virus to run its course. And in most cases, that's what happens. Your body fights it and gets better.
And we have seen it work, because like when Dr. Brantley and Nancy Wrightball came to Atlanta, obviously they said that was a big part of what they were doing. Try and keep the rest of the body alive so that it can fight that off. I mean, is that kind of what you see? And is that also proof that it can work as long as it's under control and you have people who know what they're doing?
Right. And the treatment for these kinds of episodes really is twofold. One is on the individual level, and that's treating and supporting those patients. And what we see is that the mortality, the percent chance of dying when you're treated in the United States, is different than it is in Africa, because we do have different resources. We do have the ability to do some things there that's not so ubiquitous in Africa. And then from a system standpoint, you're right. Being to really having the right resources to track and follow these cases, isolate it when we can. That's the key to keeping it contained when it gets to the U.S.
We've also seen instances where they've used Dr. Brantley to give blood transfusions because he has fought that. Can you explain how that might help someone who is fighting this, and kind of what the logic is with that a little bit?
Sure. So what we do when we create a vaccine is we try to create antibodies. Antibodies is our sort of a natural fighter that your body's immune system creates to fight very specific bugs or viruses. So once somebody's had the Ebola virus, their body has created these antibodies, their immune system has created these antibodies that can then go and attack that virus to overcome it. So knowing that somebody has those, that can be very helpful in recreating that.
Can you talk about what it's like to be a doctor and a nurse and to every day to deal with not just something that hits the media like this in Ebola, but flu and things like that? How you guys, as a group, come to work every day, and that's what you guys are here for, to kind of fight those types of things and help people out, no matter what it might be, every single day. Can you just talk about that feeling and how nurses and doctors are coming to work and they're, still confident in everything that you guys do?
Right. So that is part of our job, is to take care of the sickest of the sick, and people that have all sorts of things. You had these big scares back in the late 80s when HIV was a new type virus that was out there, and people were very frightened of it. But with time, we learned to control the symptoms. We learned to know what to do and what not to do. And whether it's the flu or SARS or MERS or now Ebola virus, it's our job to know what to do and how to treat those patients, to take the right precautions. Obviously, we don't want to get any of these weird diseases either, so we're going to do everything we can to protect ourselves as well.
Did you ever feel at a point, because we know doctors go through a lot of schooling and all that, did you ever think that this would be something that we would be talking about? Or is that part of the plan, that you never really know what's going to happen?
Well, I mean, you never can predict what it's going to be, but like I said, when you look back through history, you think of smallpox that killed hundreds of millions of people, you think of bubonic plague that killed hundreds of millions of people, you think of polio more recently, measles you mentioned before. Right. All the infectious diseases that came up, killed a lot of people, and then we overcame that and created vaccines and treatments to get through that. So, when you're training as a medical care provider, whether you're a physician or a nurse or anywhere in between, you know that these are the risks. You know that people are sick. You deal with them every day. And you always know that there's something that could come up, and we take it head on.
And I guess finally, what would you tell people at home who are seeing this, and they're seeing it play out, and the reality is we know 3 people have had it here in the United States, but what do you tell people to, as far as the plan, what do you tell family members, maybe friends, things like that, of what they should do, what they should be aware of, I guess, at a time right now where people are a little bit scared in a situation like this?
Right. Well, I mean, I think in some ways people are worried because this is a really bad virus, and if you get it, there's a good chance that you could die. But people also have to understand, what the risks are at this point in time. The chances of someone just walking around and getting Ebola virus, based on the exposures that the CDC has identified, is extremely low. You don't tell people, people don't stay indoors for fear of lightning strikes. They still drive their cars. You have a much greater chance of getting hit by a train, getting in a car accident, being struck by lightning than you do at this point of getting the Ebola virus. So it's something to be very vigilant about. It's something that all hospitals are being very vigilant about. But I don't think people, in their daily lives need to be walking around worried about, is the Ebola virus going to jump up and get me? Use normal precautions when you're out and about. Wash your hands. Do the basic things. And when the risks become higher, when we find other problems, then we can talk about, hey, we need to take extra precautions.
Dr. Lewis, thank you so much for taking time with us. Of course, you can see much more of this interview on our website at KAGS-TV.com. We'd also like you to be part of the conversation on our Facebook page and Twitter, and use the hashtag #FactsNotFear.